Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined today with Jason Martin. Dr. Martin, he's a board-certified plastic and reconstructive surgeon. He's rocking the what did we decide that's called? The Hemsworth?
The Hemsworth?
Hemsworth. He's rocking the
Basically,
5 o'clock
I did
shadow.
not shave this morning.
Yeah, it's working for you.
Is that working for me?
It's working.
That's good.
Yes.
What's our topic today, Amy?
Our topic today is good. We're calling it recovery expectations because oftentimes what we hear after surgery is, people have a lot of concerns about what if what they're experiencing is normal, because most of what we give them in their paperwork prior to surgery is what to do, when to call us, essentially.
So I don't know what you tell the patients, but when patients talk to me before surgery and they're deciding if they want to go with me or not, I tell them that they have no recovery. All surgeries, you do the surgery and you're fine and you're beautiful afterwards. That's not the case.
Well, it makes it hard when I come in the room and the person has just talked to you and they say, well, Dr. Martin said I'd be totally fine.
Yeah.
I say, yes, you will be totally fine.
So,
however.
Right. Everything in life has a cost. This is the Catholic part of me, like creeping out. And with surgery, recovery
is the cost.
Is the reality.
Mm-hmm.
Now, would you say that a majority of the surgeries we do, that the recovery is not as bad as people think it's going to be? I mean, honestly.
Yes and no. I
Okay.
think that people have misconceptions about certain surgeries being hard and or easy. So I think in those cases, it may not meet their expectation. It was either a lot easier than they expected, or in some cases, people who think something's going to be very easy, it ends up being a little bit harder than they thought.
Right. Rare is the patient that knows exactly what the recovery is going to be. Sometimes they have a friend or a family member that went through the surgery and they have a better idea. But you're right. It's kind of a nebulous thought, and people come in with these strange ideas what it's going to be. And we'll obviously go through that today. In Colorado, half the people come in complaining that they can't exercise on week 1 after surgery, which it's like, you got to give yourself time to recover. So, I mean, I think this is a great topic. I think this is probably apropos for anyone considering cosmetic surgery or plastic surgery or any kind of surgery.
Yeah, we're going to cover kind of our 4 main big surgeries, just because we obviously can't cover every single surgery in this podcast. We do have a great library of podcasts where we break down most of these surgeries in extreme detail and talk a lot more about what to expect. So we're kind of cover the things I picked for each of these are the things that people may not think about prior to surgery, or that they set really unrealistic expectations on themselves. And that's really, with expectation versus reality, I think it's so much of that pressure we put on ourselves. And a lot of times it is because of maybe a friend who's had this surgery and their recovery was so easy. It's like, if you know someone who had 5 kids with natural childbirth and no pain, and then you're having an epidural and dying a day and a half later, still in labor. It's expectation versus reality.
Also, there is a lot of responsibility on the doctor's office, and we've failed sometimes at this of creating expectations that the patients can really hold on to about what to expect.
Yeah, and at the same time, not letting our expectations for how they should be doing dictate how they are actually doing.
That's where we get in trouble, because sometimes you just really don't know how someone's going to react to pain or discomfort or nausea or frustration that they can't move around as much. Yeah. And that really does affect it. So you're right. I mean, I think it's kind of a mutual thing. You're going in this together. You got to work through it together. Establish expectations as we would expect them to be at the beginning, but that may change over time.
Absolutely.
Okay.
And so this is a great episode for anyone who's considering plastic surgery or any type of surgery, really, to listen to, and just kind of things that you may not have thought about with cosmetic procedures specifically, but these apply really to any surgery. So let's start with facelift.
So we're hacking recovery. That's what we're doing. Now we got to make this salacious.
It is not salacious.
You listen to this podcast, your recovery will be half the amount of time.
Nope. See, that's the expectation. The reality is that your recovery will be what it will be. So I think
kind of a buzzkill, Amy.
I am. So the big things with a facelift, I have a little list here of things that you should absolutely expect. Bruising and swelling. I think everybody expects bruising and swelling.
Unfortunately, I have patients that have no bruising or swelling, and they have tons of friends, and then those friends come in and say, Dr. Martin, I want the facelift that so-and-so had, because they had no bruising or swelling.
Correct.
That's what I want. Sign me up for that.
Right.
The no bruising or swelling facelift.
Yes. And they're going to be black and blue for 4 weeks.
Right. 100%.
So there are rare times, absolutely, when someone has very minimal bruising and very minimal swelling. However, that's the exception. The reality is that most patients after a face or a neck lift are going to have some amount of bruising and swelling. And what might surprise them is that their bruising specifically may be around their eyes, even if we don't do anything on their eyes. And that usually surprises people. Like they expect to be bruised in their neck. They expect to be bruised in their actual physical face. And then where their bruising sits is right underneath that eye, right along the orbital bone, because it just likes to settle there along the bone.
And it tends to stay there longer than almost anywhere else.
Yeah, because that skin's really thin, so it gets kind of trapped there. And that is definitely something that people don't expect, but it's absolutely normal. So that's normal. Bruising and swelling, normal. Most likely going to have some of that. Numbness is the one that nobody expects. No one expects to be numb.
Which it's funny, as the surgeon, you do this, you just assume, this is the problem, you just assume that, if you elevate your skin and divide all those little micro nerves in there that give you sensation, that you're going to have some numbness there until those nerves grow back. But it's not readily comprehended by most patients. They just don't really comprehend that. So I try very hard to tell patients you're going to be numb in the area we did surgery. But even then, when you tell them that, they come in and they're like, wow, I'm still numb,
Yeah, I think it's the length of numbness, and that's where...
So how long does that usually last for a facelift?
Oh, there's the expectation again. So I tell patients to expect some numbness lasting up to 6 months. Not everywhere, but there will probably be some areas that are numb for several months, and even up to 6 months is completely normal.
Okay.
Yeah, I think something that people are surprised by is how you can be numb and in pain at the same time. And we'll kind of talk about that more with one of our other surgeries. And sometimes the numbness is in areas that are a little bit distal to the area of surgery, so a little bit farther away or a little bit above or below or around it. Because when we put in that initial numbing solution, it has a spread. So there's some areas that might feel numb that didn't necessarily have surgery, quote unquote, have surgery, but they still feel numb. And they still can hurt, but they're somehow numb and they hurt at the same time. It's weird.
Right.
Yeah.
And then you're talking about immediately after surgery.
Yeah.
And then that numbness or the local anesthetic that we put in wears off. And then after that, you'll have numbness specifically in the area of surgery for a couple months, up to 6 months. We've never had someone, I think, longer than 6 months, but I'm sure there has been.
Could be.
Yeah.
I mean, nerve stuff can take a long time to go away. So numbness, you're going to have a little bit of it somewhere. Most likely it'll last for a little while, longer than you think, but it will eventually go away. Sensation will return.
Drains are something else in recovery that even though you talk to people about them, they always seem surprised that they have drains. Some of that is coming out of anesthesia. People aren't really thinking correctly. Yeah. But you definitely have drains in. In most cases, in most facelifts, in most neck lifts, you'll have a drain. Sometimes you don't, but most of the time you do. And that drain's going to stay in 24 or 48 hours. Drains hurt. Drains with tummy tucks hurt. Drains with facelifts hurt. But by no means is it the worst pain you've ever had. Would you agree with that?
Yeah, I still, though, every time I take somebody's drains out, I get them all ready. I talk them through it, and I say, I hope the person who takes out my drains is nice. I'm nice.
That's why I don't take the drains out.
I know. And I do hope that, because it isn't comfortable. And a lot of what's uncomfortable at the drains, specifically with face and neck lift, is where they're located. And I think that's what surprises people more than the drain.
So why don't you tell
itself.
people where they're located?
So the drain is going to come out behind your ear. So it's high. And I think that's what people are surprised by. I think they think drains go down. In this case, your drain goes up. Your drain is up behind your ear. Like if you touch the top of your ear and then push it down toward your head, right there along that bone essentially is where that drain is coming out. So if you think about it, it's not even so much that the drain hurts, it's that you have pressure on a really thin area of bone for 24 hours. So it gets annoying. It's annoying. So people think their drains are like antennas. They come up, and that's what surprises people, that they don't come down.
This is always around the time of the conversation. We've mentioned this before, where patients talk about, did you take my ear off? Mm-hmm. And put it on the side of the surgical field.
Set it on the Mayo stand while we do our thing.
And I made the joke that I have a little cocoon couch area where I put the ear, make sure it's okay.
Yep. Like a little cot, an ear cot.
Something that Barbie would have.
Like an old matchbook with a little cushion in there
and
for
then
the ear.
Put the ear back on. Yeah, so it hurts around your ears. There's a lot of nerves there, sensory nerves, and those are all angry because you've had surgery. Mm-hmm. But once that drain's gone, how long do people have pain for after the drain's gone?
Maybe 30 minutes.
Nice.
It is, and that's why I reassure people, before I take them out also, this is going to be uncomfortable, but trust me, 30 minutes from now, you probably will feel like you don't even need your pain medication anymore. And that's also surprising to people, because at that moment when they come in, sometimes, they've been wrapped up, they feel kind of out of it. everything just kind of feels off. And like I had a patient whose friend brought her in for drain removal. And she's like, I don't think she's okay. Like, I think she needs something else. Like, she was really overly concerned. I'm like, she's going to be just fine. I called her about an hour later to just check in, see how she was doing. She's like, oh, I'm sitting at my desk doing emails. Yep. Like, you're fine. So it's not bad. I mean, it is a short-term drain. It's not in there for a super long time. So it's not like it's hard to get out. It comes out easily. It burns and stings, but 30 minutes later, you're pretty much feeling so much better now that it's gone that like it's great.
Yeah.
It's a good thing. Yeah.
And it's a couple days after surgery and then it's out. So I think most people can last that long.
Absolutely. If you can just get through that first day and a half, like you're going to be fine.
All right. What about tightness? That's a common complaint, or that's a common component of recovery.
It is. And I think people, when you bring it up to them, then they kind of are like, oh yeah. Like people say, like, it feels so tight. Like, how long does it feel so tight for? I'm like, well, you want it to feel tight.
Hopefully forever.
Like I wish I could say it will stay tight forever, but it won't. So I'm like, you'll miss that tightness when it's gone. And then they're like, oh yeah. I'm like, yeah, it's tight because we pull it tight.
Yeah.
So I think it's one of those things that people just don't expect.
And it's mainly tight because of the swelling.
Correct. Yeah. Pressure on it, not so much the
right.
pulling.
It's more of a pressure tightness than true tightness. And that gets worse before it gets better. I think in the first week or two, that's when you really feel tight. So even right after surgery, you may feel okay. And then once you get your wraps off, and definitely have a wrap, we'll talk about that too. In the recovery, you'll have a wrap on. That tightness will sometimes get worse before it gets better.
Yeah, and it's not even just tightness in the surgical areas. Like a lot of people complain of just like a tight feeling in their head, and that's where what you're saying about the swelling.
Yeah.
Someone came in recently and said it felt like they had a shower cap on, or a swim cap, like a too tight swim cap, like just kind of like squeezing their whole head. I mean, even though we obviously didn't do surgery on any of that part of their head, it still just kind of feels tight everywhere, and that's normal. So tightness, expect it. It's normal. We kind of talked about ear pain a little bit, but that is something that. Your ear is really the epicenter of this surgery. Like it is the fulcrum of the entire
ground
pole.
Zero
it
of
really
the
is.
facelift.
Like it's
and the neck lift.
It takes a lot of work during the surgery. It's got a little retractor pulling it really far forward for a decent amount of time. You know, it's having a lot done to it. So your ears, expect ear pain.
Your ear is not happy.
No, it's going to sound like feel like you're underwater.
Your ear is basically saying to you, this face and neck lift was not worth it at all.
Right, like something, it hurts.
But it gets better. It gets better. And again, that tightness, the swelling, the ear pain is all common, definitely in the first week or two after surgery. We've mentioned this before, but just kind of a caveat. Sometimes people have a hard time hearing because during surgery, some of the irrigation or even blood can get down into the external ear canal, and that can affect hearing. So that's something to consider. One other thing we listed on here is sleeping. I think after a face and neck lift, this is one of our bigger complaints, or one of the parts of recovery that I think people struggle with the most. Don't you think?
I think it's more how long it takes for them to feel like they can sleep normally.
Because a lot of people are side sleepers,
Yep.
and so you have to kind of sleep on your back with your head elevated, and that could be difficult for some people.
It's not even so much like sleeping itself. It's that I think people expect that, when I say that you're cleared to sleep on your side, that they'll instantly feel comfortable doing so. And even if they haven't been having pain at night, as soon as they start trying to sleep on their side, then it does hurt. They start to realize, oh yeah, it does hurt to lay on my side. So again, setting an expectation on yourself that like, yep, as soon as Amy tells me I can sleep flat, I'll be laying on my side, sleeping like a baby, curled up in the fetal position. May be true. Like for some people that is the case, but for the majority, I would say it's maybe even 4 to 6 weeks before you truly feel comfortable sleeping on your side.
Yeah.
And it might even be longer. And that's really just a person-dependent thing.
So recovery from facelift, expectations, how long are you out of service for?
Again, that's where the expectation on it becomes
That's
challenging.
my point, yeah.
Yep.
So we could tell you in a couple weeks that you could feel comfortable going out in public, but some people have bruising around the eyes like we talked about, and they may not feel comfortable even with sunglasses on. Mm-hmm. We could tell some people that the swelling lasts for 2 to 4 weeks, notable swelling, and then decreases from there. But that can last even longer. We've had a few people like that. Mm-hmm. We've had a few people with ear pain last for more than a couple weeks.
Yep.
So it really is, it does vary per the patient. But in general, you will have bruising, you will have swelling, you will have numbness in the area of surgery. Most likely you'll have surgical drains, and that will be a bummer for the first 2 days after surgery or a day, and then those will be gone. You'll feel great. You definitely feel tight, and hopefully you feel tight for a while because that means the surgery did something. And that will loosen up, and you won't look weird. You'll look normal and refreshed. You'll definitely have some ear pain, and that can vary from a couple days to a couple weeks to even months. We've had a few patients like that, and then it's all gone away. And sleeping is always a problem with facelifts and neck lifts. So,
yeah. So these are things that you may not have been anticipating if you're considering a face and neck lift, but now you know they could impact your recovery.
So we're focusing on all the negative stuff. You look awesome after surgery.
Yeah,
About 4 or 6 weeks out, you come in, you're like, that was worth every part of the bruising, swelling, numbness, drains, tightness, ear pain, and sleeping.
Yes.
Problems.
And you might be that person who's like, you know what, I listened to your podcast and you told me all these things, and a week later I was, sitting out in public, out to lunch with no bruising, no swelling, no pain, no discomfort. I didn't even realize I had drains. I've been sleeping like a baby, and it's all great.
Well, I tell the fellows all the time, undersell and over-deliver.
That's right.
So,
yes.
Next one.
Next one is breast augmentation. We're kind of just moving down. We're going.
We're starting from the head and
Yep.
going down to the feet.
Yep. Yeah. So I think most people have probably known someone who's had a breast augmentation. So these people tend to have the most unrealistic expectations, good and bad. So you might have a friend who, tells you that it felt like there was a 20-pound truck on their chest when they woke up, that the weight was awful, that they couldn't breathe, that they were in constant pain, they have numbness and tingling down their arms. And then another person who's like, yeah, I was back at work the next day.
Yeah.
Literally back at work the next day. So it's this surgery more than any because it is so common. I mean, as we know from previous discussions about breast augmentation, is the most common by number procedure done in the United States. So chances are someone who's had a breast augmentation, and you may have expectations going into it of what your recovery is going to be like. The number one thing that women complain about that they do not anticipate is back pain.
Oh, yeah.
They come in a couple days after surgery and they're like, nothing else hurts. My back is killing me. And that is for a couple of reasons, which I explained in my little post-op video to everybody. The number one reason that your back hurts is because you are protecting your chest. So if you kind of really over-exaggerate it, you think of pulling your shoulders, like your chest, like your shoulders down towards your chest, hunch your upper back, and stay like that for
Just look
days.
at a picture of me. This is what I look like all the time because of surgery. So imagine this kyphotic or hunched over. You can look at us on our YouTube channel. Amy and I are both doing it.
Shoulders pulled in,
Yeah,
your
your shoulders
hunched.
are pulled in, your neck's down.
Yep, you're afraid to take a
That's
deep
how I do
breath.
surgery because you're like kind of focusing down in there.
Yeah, and then you've been sleeping in an incline. So,
Yeah.
your back is just killing
Your
you.
mechanics are terrible.
Yep. So the solution for that is to just remind yourself, like, it's okay to let my shoulders drop. Take a deep breath. Put some ice or some heat on your back if your doctor says that's okay. Have somebody give you a little back massage. Like, it's okay to let those muscles relax, and your body's going to be protecting itself on purpose. You had surgery there, but your body just sees that as injury at this point, so it's normal.
Right. Breast augmentation is painful no matter what anyone tells you. And people guard with pain. And that guarding is where you get these muscle spasms and et cetera, and pain and shooting, discomfort.
Yeah, you do like splinting, self-splinting. So swelling is the other big one. Everybody expects there to be swollen, but then they're more swollen than they think.
I think this is the reality show aspect because I'm convinced in some of these patients they show in reality shows, it's not really the time frame they're saying. It's not real.
Yeah, the time frame's not
Oh,
correct.
no, this lady is a week after surgery and she comes in no bruising. It just doesn't work that way. I mean, people do swell after surgery. If you put a breast implant underneath your muscles, your body's going to be like, WTF, what just happened here? And we're going to come in there and cause inflammation. And even if you do a perfect surgery, you're still going to have swelling after surgery. It's not going to look normal. A lot of the swelling you see with breast augmentation, this is dealing with expectations, are above the nipple and areola. And that tends to, people then look at themselves in the mirror and they're like, oh my God, I didn't sign up for this. I have these rocket breasts with swelling all the way up to my clavicles, up to my shoulders. And that always goes down. That's real common. And why do you swell up there, Amy? Why do you think that the swelling occurs mostly on the upper part, not the lower part?
Just the way things drain.
Right?
It gets kind of stuck.
Yeah, and also your muscles there. Your muscle is full of fluid, and when you get inflammatory factors in there, it makes your muscles swell more. And your muscles swell, and they feel tense, and then they spasm. And then you have pain in that area. So This all kind of makes sense. You're going to have swelling after surgery. I personally, Amy's better at dealing with patients after surgery, but I tell them is don't even look at anything. Just give it a couple weeks. I mean, that's impossible.
Well, it is, especially when like you can't look down without seeing that you feel like you have implant literally like just resting under your chin.
Yeah, that's kind of hard.
It's hard to get around that, and that's people are kind of freaked out like, oh my god, they're going to stay like this, are they? Like, no,
They never do.
They will not. That swelling goes down.
And I actually said this to a patient one time. I was like, if after surgery your implants look like they're in the perfect position, that's probably not going to be a good surgery, because once the swelling goes down, then the implants will appear dropped or saggy, right?
For a primary breast aug,
For a primary breast aug, you
true.
always have to qualify.
Yeah.
We know that you're smart. We know that you know plastic surgery.
Well, but if we don't want someone out there thinking they're going to have an exchange and have that happen again,
Okay, yeah,
which
true.
it doesn't. If you have an implant exchange,
You're right. You're right.
You're not going to experience all this again,
You're
most
always
likely.
right.
Yeah. So they're going to be swollen.
You may be the surgeon and the beauty, You.
I'm just taking over the world. So back pain, expect it. Know that's going to probably be at least a little bit present. Swelling, obviously, definitely going to be present, will go away. Sensation changes. That's something that some people ask about. They're worried about losing sensation.
Yeah.
What is more likely to happen is that you are going to have increased sensation.
Which is not good.
No.
It doesn't feel great.
No, I mean, it's, women who breastfed, it's that like kind of constant irritation of like just stimulation of your nipple and areola, like not pleasant for extended periods of time. So some women don't have that. They have no changes in sensation. Some women feel like they lose a little sensation in the very short term after surgery because of some numbness. Other women, it's like they're just on, and that's not fun either. So that is something that is to be expected in some variation of sensation change that will probably go back to normal.
So this is not a recovery thing, but after surgery, one of the unwanted outcomes from a breast augmentation is loss of sensation in the nipple and areola. And we've been fortunate not really to have that problem, but it does occur, and it does occur more often with larger implants. Something you need to consider, like large implants. But in most cases, it's the hypersensitivity. And in all cases, at least in our experience, that will resolve. Rare is the person that would last for a long time. But you have to go through a period of time where that is a problem.
Yeah, and it takes a while for everything to kind of calm down.
If you look on our YouTube channel, one of our slides made from Sarah, the point is I can hear my implants with an exclamation point.
Oh, you're moving on to the next one.
Yeah, I'm sorry. I can't.
Yeah.
I couldn't wait to get to this.
I had more to say about sensation, but that's all right.
Okay, that's all right.
Yeah.
I just wanted to get to this one because we get this a lot.
Yes. I get panicked calls.
Very panicked.
Yep.
Like something is going, it's a ticking time bomb. The thing's about to blow up. Something is deadly wrong with my breast implant.
It usually starts off with this, like, you're not going to believe this, but
You're not going to believe it.
I think I can hear my implants.
I can hear my implant.
Yep. Or I hear bubbles.
There's some gurgling going on down there.
I hear them.
It's having a baby. My implant is having a baby.
No one's ever said that to me, but they definitely think
Did
a
I push
lot.
it too far?
Yeah.
Okay.
It's really common. This is a very common thing to have people experience after surgery, or like weird, like even if you can't hear the bubbles, maybe you can feel the bubbles. Like you're sure you can feel the bubbles. Like,
and I've wondered about this because we're at altitude. If this is not as much of a problem at sea level.
maybe. I mean, that's people. There are a lot of women who are concerned about traveling initially after their breast augmentation, that somehow the altitude will affect that, which it won't.
That's an expectation. So with any surgery, when is it okay for you to get on a plane? Not any surgery, but in general.
I mean, with your surgeon's clearance, we're probably going to let most of our patients fly a week after surgery.
Right.
Now, if they're flying a very short distance, like from Denver back to Aspen, I'm going to let them fly a couple of days later. That's just because I don't want them to be far away. So we're not going to let one of our patients fly really soon after surgery because we don't want them far away from us. So,
I mean, yeah, I think a week's reasonable. The problem is if you have a problem on the plane, they have to land the plane and you have to seek medical care. But any kind of problem you have would most likely not be life-threatening, and that's a big disclaimer there, an asterisk. But yeah, I think a week is reasonable. But you might want to wait 2 weeks.
and for some surgeries, we do recommend longer. And
Yeah.
some of that's, we'll talk more in one of our other slides here, just about your own comfort for an extended period of time.
Yeah.
So,
I think our practice is a little bit unusual because we get people flying in. So
yeah, we're a little bit different
Yeah.
in that sense. But so what are they hearing, Dr. Bryant? When somebody says they can hear their implants, what are they hearing?
definitely, at least with our patients, is usually related to altitude changes. You know, they're driving from Denver to the mountains, and you go up, what is that, like 3,000 feet?
Yeah.
All right. So when the altitude changes, just like anything else, what's the example? The chips, like a bag of chips.
Oh yeah, or coffee.
Yeah,
Anything
coffee, yeah.
starts blowing up in the back
Exactly.
of your car.
The
Yeah.
pressure changes, and then you get an expansion, and that's where usually where you hear these sounds is more related to the fluid that's around the implant, not the implant itself. Silicone, my understanding, is fairly inert, so it's not like the implant is expanding. It's
There's no air in it.
Yeah, it's the fluid around it, or the air, any air that's around it. Also, right after surgery, people get the Rice Krispies, where they feel subcutaneous air, which happens with surgery sometimes, and you press on it and they snap like a Rice Krispies does in milk. I mean, are Rice Krispies around anymore?
I think so. I don't go to a regular grocery store, so.
Listening to this
Maybe.
podcast, I realize how many examples I say, is this around anymore? I need to get more hip and to say Rice, whatever. Lead the trend. Rice Krispie sound, that crackle sound, you can have that. That's called subcutaneous emphysema, and that's very common.
Yeah. So if you can hear your implants, definitely talk about that with your surgeon. But
We did have a patient one time, a younger woman, real nice, sweet family, but they were very concerned, and for some reason went to the hospital. This was in a small town, and got an X-ray after her augmentation because they heard the crackles,
the bubbles.
and they called me up like, "You're never gonna believe this. There's air under my skin." And I was like, "Yeah, that's expected, especially with this kind of surgery." "Oh, really?" Because we just spent like 3 hours, in the hospital. The hospital told them they were fine. All right, what's the last thing, Amy?
So we go back to sleeping again. So of course, it's not the act of sleeping that's hard after this surgery. It's the positioning. And for those dedicated side and or stomach sleepers, which is most of us, it's going to be a while
What are
before
you,
you're
Nils?
comfortable.
Your back
Oh,
sleeper?
see, he'd be fine. We do breast dog on Nils. He'd be totally fine. He could have a facelift. He can have a breast dog.
I don't know if I totally trust
Sleeping
back sleepers. Yeah, no, it's like you're in a coffin. It's like you're one step closer to the big ending. At least a side sleeper.
Laying there waiting to die.
I know.
You don't think people die on their sides?
Sometimes you want to like lift up their eyes, to make sure that put your hand over their mouth, make sure you feel some humidity
Watching
there.
their chest rise.
Yeah.
Yeah. So if going into surgery, you know that you have a really hard time sleeping not on your stomach and not on your sides, definitely talk to your doctor about that. They might be able to give you some great tips. I've got some good tips I give to our patients about sleeping. But it also might be a long time, like several months, and it may not be ever. If you get a very large breast implant and you are a stomach sleeper who is flat-chested and you are going to a big
You got to
implant,
change it up.
you may never feel comfortable sleeping on your stomach
you
again.
You won't. It just doesn't feel right.
Nope.
And we have that conversation with our patients, and I've had a few patients come in, not our patients who've had breast aug, and said that to me. They're like, "I wish I would have known this." I think they still would have done it,
Yeah.
but they at least would have understood what they were getting into.
Right.
They had to change their whole sleep style.
Enjoy those last few nights sleeping on your
Yeah.
stomach. Like, it is a thing. And
It's like the night before a marathon. Just eat the pasta, enjoy it, because the next day it's
you're gonna
over.
be throwing up that pasta on the side of the road.
Right.
So, I think more so than anything, the reality versus the expectation. The reality is you will most likely get back to your natural sleeping position. The expectation is that that's going to happen at like less than a month or 2 weeks after surgery. The reality is that probably is going to be a few months, especially if you're a stomach sleeper after a breast aug. Side sleeping will be easier.
Sleeping is like the recurring theme in this.
Well, without sleep, we die.
I know.
So we like to sleep, and people like to sleep how they like to sleep. That's wise right there. Okay. So
I'm just pondering that really wise statement.
it was
You just
wise.
said. All
It
right,
was
let's go to
deep.
the next one.
Okay, well, let's recap. So breast augmentation, expect.
I'm good. I can list these.
'Kay.
Back pain, for sure. Swelling, definitely above the nipple and areola. Sensation, you're going to have weird sensations there, and mostly hypersensitive sensations, and that can last for weeks to months. You can definitely hear your implants. They talk to you, okay? Or you may have some snap crackles. That's the subcutaneous emphysema. And sleeping is going to be an issue if you are a side or definitely a stomach or sleeping on your stomach.
Mm-hmm.
How would you say that?
Stomach sleeper.
I was about to say in a prone position.
Nope. Now that sounds all creepy and
Yeah.
coffiny. Okay. Our next
Stop sleeping
one.
in your prone
All right,
position.
stop sleeping in your prone position. So liposuction. Now this is the one that I feel like most people have the most unrealistic
Oh my
expectations
gosh.
about. Patient called today, is getting married in less than a month, wanted to have liposuction before her wedding.
Is this for real?
Yes, this happened today.
Even though she saw us and we told her
Has never seen us.
Okay.
Wanted to have a consult, surgery, and be recovered in less than a month from liposuction, because people think that liposuction is like that. Again, maybe your reality TV thing is at play here.
So imagine that you had like a NASA type team and you could do liposuction and then put them in a cryo tank and hyperbaric oxygen and like all these medical therapies. Do you think you could lessen the recovery by at least 25%?
Probably could.
Yeah. But it still wouldn't be quick enough for 4 weeks.
No, it wouldn't. And also the expectation of what that liposuction is actually going to be able to do to your body as far as changing it is probably not there either.
The sad thing about that patient, she'll find somebody to do it.
Yep, she will.
Ugh.
Yep. And their dress really won't fit. So, liposuction. Number one thing that people are not prepared for is the amount of pain and the length of discomfort.
So we use energy-assisted devices like Body Type. Please see our episode on that. It's very good. And those lessen the pain, lessen the swelling, and lessen bruising. It still hurts. It still hurts. Every single patient says, this is for real.
Yep. And
now, they don't regret it because they already see the change after surgery, but you definitely have pain after these procedures.
And it's more so the length of pain. And then pain is maybe too strong of a word, but discomfort is what I'll use. So, on a near daily basis, I have someone who calls me who is anywhere from 4 to 12 weeks out from surgery and is, wondering why they're still uncomfortable or why it still hurts when someone hugs them tight or they bumped into something that still hurts. Yeah.
It's always something inconvenient, like at work, like someone brushed against me and I winced,
Yeah. Yeah, it still hurts. It's still exquisitely tender. They'll say, it still hurts. I'm like, yes.
Yeah.
You will likely have some amount of discomfort in the areas of liposuction for 6 months. And I don't mean it's going to be constantly uncomfortable. I definitely don't mean that. I mean, in situational things, like maybe a weird position in a seat at a gym, if you get a massage, those areas will feel odd and perhaps painful and tender and uncomfortable for an extended period of time.
Before I became a plastic surgeon, I never knew how exactly liposuction on saddlebags would affect women when they go to the bathroom.
Yep. It's going to hurt to sit down to go to the bathroom.
Every single time.
Yep. That's what's going to hurt the most. And I tell all of our patients that it's going to hurt to sit down.
Luckily, you guys have this amazing hovering technique where you can avoid touching anything of concern.
Yes. By the time you're an adult woman, you have mastered the hover. Yes. So expect that. And, great. So you have no pain left at 4 weeks. Awesome. That is rare.
Yeah.
I would more expect that your pain will last or your discomfort in certain circumstances will last.
Talking about real expectations,
months.
Again, everyone's different, but you can expect that liposuction is going to be the most painful surgery you could do of all the surgeries we do, besides maybe a body lift.
Yeah. And it's more just for the length of time. There might be more in the acute phase pain
with the more major
right,
surgeries,
where those first 3 days hurt more, but you're going to hurt longer with lipo than anything else.
Yeah,
we
100%.
do. Yeah, that's just universally true. So garments, I think everybody probably has seen some reality TV show, someone wearing a garment, but at least with us, you're gonna be wearing that garment for probably at least a month, maybe even 6 weeks, 24 hours a day, maybe going down to 12 for the last few weeks, but you're wearing that garment a lot. It is going to be not as bad as you expect. See, this is a reverse expectation. People expect that sounds horrible. It sounds like torture. There's no possible way I can do that. And then you get that garment on them after surgery and never take it off, never ever leave my body.
Because it feels good.
Yes. Don't make me take my garment off. I don't want to. I love it. Yeah.
Pressure therapy. I mean, that's proven.
Feels good. It's like being swaddled. You might end up loving your garment. I had a patient come in.
I think we need that for all of humanity, to swaddle everybody once a day just to help with relaxation and
calm them down. You just burrito.
Everyone should wear a liposuction garment.
It
would make people feel better about their body contour because it pulls everything in. It's like a super Spanx. Oh, it's a super Spanx.
But
it's like a Spanx on steroids.
Yeah. So, athletes know this. Athletes use compression for recovery. It is going to not only help with your swelling, but you'll feel better with your garment on.
All right. So I know this is a side point, but do those compression garments on athletes really do anything for reals?
Yes.
I thought they just wore it because it looks cool to put it on their elbow or whatever.
It's the same reason that compression works after surgery. It helps break down that inflammation.
I remember Allen Iverson was the first NBA player that. Do you remember him?
Yes.
Yeah. he used to wear that, and it was just like so foreign to me. Now everyone wears these compression garments everywhere.
It helps. So you might go in with the expectation you're going to hate your garment and it's going to be torture, but you might
You're
end
gonna
up
love your
loving
garment.
it. Yeah.
Love
You're going
it.
to love it.
All right. Swelling.
And more swelling.
And then more swelling. And then even more
Even
swelling.
more. You wake up the day after surgery like, oh my God, I'm swollen. 3 days later, you're like, how is it possible that I'm more swollen?
Why did I do this? I should never have done this.
I'm
Look at
swollen
me.
even bigger than when I started.
It's 5 days after surgery. This is expected. Are you sure? Yes, this is
More
expected.
swelling.
More swelling. And the swelling gets worse before it gets better. Now, offices like ours who have an Amy who embrace alternative treatments, we do a lot of things. Infrared saunas, we just got that. Cryotherapy. What else do we do? We do some light therapy. Amy's a big believer in acupuncture. I always get this wrong, the Ralphing thing.
Ralphing, that's a little bit later.
Okay, whatever. So we do a lot of different things. And it does make a difference in the swelling, but it's not going to go away completely.
No, I mean, you can do everything. You can literally be having a lymphatic massage with acupuncture in a cryo tank, wearing your garment. Like, you're still going to have swelling. Now, can you reduce your swelling? Yes. More than anything, what you can help do is reduce the severity of your inflammation. So inflammation is necessary, as we've talked about many times on our podcast after surgery. It's a necessary function of healing. So without swelling, you're not going to recover. You need a little bit of swelling to bring in those inflammatory processes to help break everything down to get it going. What I think people, again, don't expect with swelling is how long it lasts. Like, you may find for months after surgery, so you've stopped wearing your garment, you have a really killer workout, maybe it's really hot, maybe if you're a woman, you're on your cycle, and oh my gosh, you're swollen again. How is this possible? My swelling's been gone. It's all back.
Does anyone say, like, my fat just came back?
Some people think that's what it is.
Okay.
I mean, we've had patients come in for follow-up and think that they're fat again. I'm like, nope, you're just swollen. Like, still, it's been
So why
3
don't we
months.
give everyone diuretics?
Because you need that inflammation. Like, forcing it out is not going to help your body heal any faster.
Right. There's some balance there. It's like a yin and yang, right? You want some inflammation there, but you don't want too much. And so, I mean, we've given a few people diuretics that have extended bouts of swelling farther out from surgery. That's reasonable.
Or who have compartmental swelling away from the surgical site.
With FYI, just a little tip for recovery. One of the best things for increasing lymphatic flow is walking. And so if you've had liposuction or you're going to have liposuction and your doctor didn't sit down like Amy does or I do with our patients, really we encourage you to walk. Walking is probably the best thing you can do. And you don't have to, at least in Colorado, people think they're speed walking. It's like a slow walk for an extended period of time. So, and that's always good after any surgery because that lessens your risk of blood clots. So,
yeah, walking is awesome. So, skin sensation and numbness, I'm going to lump together. We've kind of already talked about numbness after a facelift. Definitely the thing after lipo that I get more than anything is, like, say we've lipoed your flanks or your back, and people complain about their hips hurting. Well, you didn't do anything on my hips. Why do my hips hurt? Like, my hips hurt. They're numb. They feel weird. And that's just that, like, gravity pulling all that down. Like,
the inflammatory fluid, which is inflammatory, and then irritates the nerves, and it feels painful.
Yep. So that's why wearing your garment is important. It's going to help decrease that. But you might have numbness in some of these areas that it hurts, but it's numb. Like, it's numb on the inside, but your skin hurts on the outside. That's that skin sensation. Like, it feels like my skin's not attached. My skin doesn't feel attached to the rest of my body. Very, very common things that people say to me after surgery.
You ever tell them, like, well, you look great, so who cares?
But you look amazing. Yeah. I mean, I do.
That never works, by the way. But you look awesome.
Yeah, and that feeling, that really kind of, people describe as like that creepy feeling of like your skin's no longer attached to your body.
That's a weird feeling.
It's very strange. And some of that sensation is true because we have created space between your fascial layer and your muscle, so your skin is looser to the rest of your
between
body.
the fascia and the skin. Yeah, I got you. Yeah.
So, as that, it takes time, and then there's fluid in there. There's inflammatory fluid. So wearing your garment is going to help decrease some of that, but weird sensations of the skin, like your skin feeling sunburned, your skin feeling, like there's hot lava underneath your skin. Those are all things that are common after liposuction.
What was the patient said was underneath her skin?
Oh, men with tiny knives. Yes. It can feel sharp and stingy, like there's somebody in there poking you with a tiny knife. So
that was alarming, but
it
she's
was.
like, she's like, it's not that bad. I was like, okay.
But it's not that bad.
And it hurts. And it's going to hurt.
It still hurts.
It still hurts, and
Yes.
it still hurts. And we've had patients even a year out. Very unusual. 6 months is usually a good cap on that.
Yeah.
3 months is average. So.
But some tenderness can persist. And it's
Yeah.
not pain, but like it's just still like you notice. Like you'll remember you had liposuction in an area for a while.
Yep.
Yeah.
Liposuction, pain for sure. And it still hurts for sure. You'll love your garment. You may want to wear your garment. We had a patient.
Best friend ever.
We had a patient come in a year and a half after liposuction, was still wearing her garment. She was like, I love it.
She used it for recovery. She was a triathlete.
So
Yeah.
I was like,
Couldn't figure out what was taking her like 20
I was like, you
minutes
go,
to get
girl.
undressed.
You go. Swelling for sure, more swelling, and even more swelling. So do not stand in front of a mirror 2 weeks after liposuction and think you look great, or go get married 4 weeks afterwards. God bless that person. Skin sensation definitely feels weird, and numbness is guaranteed. Was that good?
Yep, that's good. So the big question, when should you call your doctor? And that's what we focus our post-operative instructions on. Reasons to call your doctor. Most, as you've seen, there are variations of what's normal with all of these surgeries. They can run the gamut of things that are weird, you didn't expect are happening, normal things. So that's what, as a patient, to me, that's the most important thing. Okay, so I can literally hear my implants talking to me. I'm bruised 3 weeks later, but do I have any of these symptoms? Nope, I'm probably okay. So that's what you really, with the people who are taking care of you, you yourself, the people who are caring for you, need to have a really good understanding of when you need to call your doctor, what's not normal. And any doctor's office should provide you with that.
Right.
High fever, new pain, worsening pain that's not affected by pain medication.
Pain that's out of proportion to what you experienced previously.
Yeah.
Right. So that's a big thing that all of a sudden became strong
Severe.
and is getting worse and worse.
Doesn't get better if you change positions, doesn't respond to pain meds.
Racing heart rate that won't stop, shortness of breath, not just a fever, but what do you call it? Like shivers and sweating. Rigors, I mean, that's the medical word, where you get that feeling of being really sick. Everyone's had that feeling. Well, hopefully everyone hasn't, but most have when you get that flu-like symptom, that feeling of just feeling really sick.
Yeah.
These are all telltale signs you need to call your doctor right away.
And I always tell patients that, like, listen to your own intuition. Like, if you feel unwell, like, you know the difference between what you've been experiencing. If what you're experiencing is just you just do not feel right, like something doesn't feel right, it's not going away, your surgical areas might feel fine, this pain might be somewhere else, it might be not even associated with where you had surgery. Like, those are things you should never ignore. I would rather have a patient call me and ask me 1,000 questions and have me say every single one is okay than have one patient ignore a symptom that's not okay.
That's so true.
Yep.
It's always better to call.
Always
and hopefully
better.
you have a doctor's office that's receptive to that. We are. And it has, in so many circumstances, really helped us with patient care. The quicker that you address an issue, and most of the time the issue is not consequential, it's not going to affect your outcome or your overall health, the quicker you address that issue, the better the outcome's going to be, the quicker you're going to recover from that problem.
Yeah. So if in doubt, call your doctor. So when to call the doctor, any symptom you're having, even if it's one of the things that we said is normal and is expected and totally fine. If it's not feeling fine and okay and accept, like, call. And again, I cannot emphasize that enough. Like, I would so much rather have somebody literally call and ask me, is it okay if I eat Cheerios today? I didn't see it on the list of foods to avoid. Is it okay if I eat these? And have me say yes 100 times than have one person not call because they thought it was okay.
Like every plastic surgeon's office is going to be so frustrated with us right now because patients could be, I'm eating Wheaties.
But it makes
today.
my job easier.
So like Cheerios, Wheaties, and Rice Krispies are all
Right.
cereals from the 80s.
If you hold your implants next to the bowl of Rice Krispies, do they talk to each other?
It's signaling my
Right?
implant.
I can hear them talking to each other.
Also, another thing, like when you've had surgery, any kind of surgery where you create a space underneath the skin, facelifts, breast augmentation, liposuction, tummy tuck, pretty much everything we do. If you have swelling on one side over another and it's noticeable, then that's a surgical emergency. It's probably a hematoma.
And it's not subtle, because there are absolutely going to be subtle differences in swelling side to side.
But it's something comes on quickly
Yep.
and is getting bigger.
And is notable. Like, I always tell people that, like, if you are staring at yourself in the mirror going like, am I more swollen? Is that side bigger?
Kind of.
Right.
It looks
then
about
no.
5% bigger.
Yeah, then that's
I think
normal.
I have a hematoma. Oh my gosh.
Right. If you look down and it's like double the size, or someone comes into the room and is like, oh my God, like, has that been there the whole time? It's probably not okay.
So on the post-operative orders for facelifts, I put on there with the nurses, because the nurses don't really know what I do. They can recover patients well if one side of the face looks way more swollen than the other. I literally write that on there, in normal person's terms, because people understand that. You got one side of the face and the other, and something looks a lot different, I'm going to give you a call. 99 times out of 100 is totally fine, but I'd rather have that phone call than that.
Yes, absolutely.
And that's why we keep patients in the hospital a lot of the time, just so they can have nursing staff taking care of them. Even if they go home, we'll send a nurse home with them. So it's always best to reach out to your physician, to your surgeon, contact them and tell them what you're feeling, or at least the office. And hopefully they're receptive and they have some sort of plan in place where they can reach the doctor and you can get information to them quickly.
Yeah, you are never, from my standpoint, you're never bothering us by asking us questions, ever. In fact, it makes my job easier if you ask questions, because then I know that like things are going okay. The person who like is kind of ghosting me, like, I leave the messages, they don't call me back. I'm like, well,
it's Christmas Eve. I shouldn't
like,
call them up.
Okay.
Yeah, please call.
Yeah, call.
Yeah.
Always call. So
Better.
when to call, always.
Better.
Never, you'll never get no new phone who dis.
Who wrote, was it Dickens who wrote Great Expectations?
I think so.
Yeah, so we have recovery expectations.
Yes, we do.
That was good. I think that for people to realize that expectations don't always...
Are the thief of joy.
Yeah, don't always line up with recovery. So, and that can be hard, because when you're in pain and you feel uncomfortable and then your expectations are ruined. So just imagine a trip to the beach that never works out because it rains the whole time, and you expected to sit on the beach and enjoy yourself and have one of those fruity drinks that people have that are having fun on the beach, like a margarita. Surgery's not, it's kind of like that. It's kind of like having rain when you're on the beach. Your expectations usually are not correct to what the reality is. But as with a vacation, you're always going to come home. At some point, the recovery will be over, and your results will be great, and you're going to be really happy with it.
Yeah, absolutely.
So, and you will be sipping the margarita. You should not drink alcohol after surgery, by the way.
No.
2 to 4 weeks.
Once you're recovered, go get your Mai Tai on the beach.
Yeah, your Mai Tai.
Thank you everyone so much for listening to this episode of Beauty and the Surgeon podcast. We are on Instagram at Beauty and the Surgeon podcast. We also have a YouTube channel at Jason Martin MD, where you can find videos of all of our podcasts. We love questions and feedback, so please send us your messages, questions, feedback, any suggestions you have for future episodes. We would love to hear them.
And rank and rate us.
Rank us and rate us. Subscribe. Thanks everyone.
Thank you.